Hello doctors, this is Dr. Hira Salman. So welcome to MCQ of the day. This MCQ says 35-year-old female, no family history of cancer. Mammogram report showed bilateral dense breast tissue, no calcification. Ultrasound report showed bilateral multiple cystic lesion. What is your management? So this is a very common question. In this, the age of the patient is very important. Our patient age is 35 years with no family history. This again a very important point, no family history of cancer. She has undergone mammogram. Maybe the findings is not there, the symptoms are not there. Maybe the patient is having mass in the lump, or the patient is having tenderness. So whatever the symptoms are, she has undergone mammogram, which shows bilateral dense breast tissue. So bilateral dense breast tissue, is normally, it's not an abnormal finding, it's a normal thing, especially in this particular age. So maybe fibrocystic changes, right? Because there is no calcification. Again, it's very important, no calcification. Ultrasound is done in order to evaluate whether this dense breast tissue is what actually, maybe they are the cysts, or they are fluid filled cysts, or they are having some solid mass inside, a deficit inside. So this ultrasound is a great indicator for this, in order to diagnose what is actually causing the dense breast tissue. Now, what is your management? What you are going to do? Either you're going to repeat imaging after 6 months, biopsy resection reassurance. So first, I just wanted to show you, this is cancer.org. It says mammogram shows that your breast tissue is dense. Dense breast tissue is common and is not abnormal. However, dense breast tissue can make it harder to evaluate the results of your mammogram, and may also be associated with increased risk of breast cancer, because of the dense area, we cannot see what is behind. Either it's a mass, it's a tumor, it's benign, malignant, whatever. So in order to confirm this, we will go for ultrasound. So once ultrasound is done, as ultrasound showed here, it's a bilateral multiple cystic lesion. So bilateral multiple cystic lesion in 35 years old, it's highly indicative of fibrocystic changes because of hormonal change, right? So I just wanted to show you this Access Medicine current diagnosis. Once a benign diagnosis or normal findings have been established by biopsy or clinical or imaging findings, say for example we're done with the ultrasound here and benign diagnosis is already made, then simple reassurance will provide many patients adequate. So simple reassurance, we're just going to reassure the patient. Now, if I just show you these two things, very important. This is mammographic reporting system. One is BIRAT's mammographic reporting system, and one is breast density report. So these are two different things, right? First one is mammographic reporting system, in which there are many categories, in which category 0 is assessment is incomplete, additional imaging is required. Category 1 is negative, continue with routine annual screening. So here in our case, maybe it's negative or maybe it's benign, right? Because dense tissue is there, we cannot find what's behind the density of the tissue. So we can say it's a negative, continue with routine annual screening, and benign. So our patient is 35, routine screening starts at 40. Probably benign finding, short-term follow-up, usually 6 months recommended. So probably benign finding, but here in our case, it's only dense breast tissue. So we cannot go for category 3, we just go for category 2 or category 1. So in both of these categories, we have to go for annual screening. Now, breast density report, here it shows category A is entirely fatty. In our case, maybe it's a heterogeneously dense, which may obscure masses, or extremely dense, which shows mammographic sensitivity. So these two, heterogeneously and extremely dense, both are coming under the heading of dense breast tissues. So category C, category D on the basis of breast density report, and here category 1 or 2 on the basis of BIRAT mammographic reporting system. Okay, now I just wanted to show you, this is a chart from MBOS. Here you can see if there is any finding or some symptoms like palpable breast mass. What you're going to do, you will first see the age of the patient. If it's less than 30 years, if it's more than 30 years. So in our case, it's 35 years, we'll go for more than 30 years. So in more than 30 years, mammography is highly indicated. We'll not go for the ultrasound, we'll go for the mammography. So if mammography is inconclusive, say for example, it's a breast dense tissue, right? So we'll say this is inconclusive. Then we will go for ultrasound. In ultrasound, if we found cystic lesion, then we will go just for the reassurance and follow-up. So there are two important things here: reassure and follow-up. And the first thing which I have showed you earlier, that once a benign diagnosis is made, you will have to reassurance will provide many patients with adequate relief. So your answer here should be reassurance. Okay, thank you.